Hi, everybody, and welcome to the first in our series of newly approved medication infographics. This is going to be a resource here at Pharmacy Tech Scholar to help keep pharmacy technicians up to date on the medications that have most recently been FDA approved. It's going to be really high level information, so these aren't in-depth drug information resources, but just enough for you to be familiar with what's coming out there and what you might be coming across in your work as a pharmacy technician. So the first medication we're going to be covering is Zevtera or ceftobriprole. This is the newest approved medication in the cephalosporin antibiotic class. Those of you that are working in hospital settings might come across this medication in the coming months as hospitals may be adding it to their formularies and approving them for use in specific situations. This particular antibiotic, which is going to be referred to as a fifth generation cephalosporin, has been FDA approved to treat specific bacterial infections, primarily targeting the Staphylococcus aureus strain of bacteria. So this is going to be for serious infections. It's only available as an intravenous injection dosage form. It's probably going to have a lot of restrictions around its use because these newer antibiotics that are quite potent really need to be reserved for the most severe cases or cases in which the strain of bacteria may only be susceptible to it or a limited number of antibiotics. We always try to preserve, the activity of these potent newer agents. So again, be aware this is going to be indicated for bacterial infections, serious bacterial infections in the hospital setting. There are many side effects, as with most medications, but a few that we'll highlight here that are included in the warnings of the prescribing information include seizures, which have been associated with this drug in clinical studies, and as with all antibiotics, a risk for Clostridium difficile infection or C. difficile associated diarrhea. So some helpful hints there are always remember that the use of antibiotics in general can be associated with C. diff. As you kill some of the good bacteria that lives in our gastrointestinal tract, you become at risk for overcolonization and therefore infection with C. diff. And also, when it comes to memorizing brand versus generic names, which is an important part of working as a pharmacy technician, and for those of you that are going to be looking to take the pharmacy technician certification exam, something you need to do well in memorization. Most cephalosporin antibiotics are going to have a prefix that is either Ceph as CEF or Ceph as CEPH. So this newer antibiotic is no exception to that rule. So follow us on social media to continue to get these updates and infographics. Feel free to shoot us some requests. We're going to be doing all sorts of series when it comes to older medications, drugs at the class level, medication safety tips. Looking forward to helping all of you stay up to date and helping to advocate for patient safety and elevate the profession of pharmacy technicians.